Hello learners, and welcome to our next stop on the axial skeleton tour, and that is the spine. It's also called the vertebral column or the vertebral column. Okay, folks, now the spine is going to be the central axis of the axial skeleton. So as you can see, we have our axial skeleton, we have our skull, the vertebral column, and we have our rib cage, which we're going to get into in the next video. And this is going to be our central axis, which is going to be our vertebral column. It's made of 24 vertebrae. Okay, and instead of trying to remember all these vertebrae, we put them into categories. So there's going to be a category called the cervical vertebrae, another category called thoracic vertebrae, and then the lumbar vertebrae. We're also going to talk about the sacrum and the coccyx, which is going to be different vertebral bones that are, again, fused together. Okay, folks, but they're not a part of that 24 that we're speaking of. Now, the next thing we want to talk about is, okay, we know how they're grouped. Well, how are they named? So when you are naming vertebrae in these three different groups, you have the first letter of the group and the number within that group from the top. So let's focus on the cervical vertebrae first, just so we can get an idea. The cervical vertebrae are going to be all the vertebrae here. You can count them as 1, 2, 3, 4, 5, 6, 7. So there's going to be 7 of the neck vertebrae. Okay, how we name them? C for cervical, 1 through 7. So that means you can have C1 through C7, which is what you have here. You can name it C1 through C7. I just put C1 through 7 just to make it faster. It's not that faster, right? And this is going to be our, again, our cervical or our neck vertebrae. Now, here's the interesting part about the cervical vertebrae. Out of all the groups, the cervical vertebrae have 2 unique vertebrae that's unlike any other. And that's going to be the atlas and the axis. And we'll talk about these 2. Now, the other 5 vertebrae, they're going to have the same similar shape that we're talking about, which is going to be the body. They're going to have the same type of foramen hole, and they're also going to have the same kind of spiny process. But when it comes to the atlas and axis, these are a little bit different for a couple of reasons. First off, the atlas, or C1, that means cervical vertebrae 1, holds up the head. Okay, so this is really important. It's going to hold up your head, and it's going to allow you to nod your head. So if you go ahead and rock your head forward and backwards, that's because of your atlas C1 vertebrae. Okay. Next, the axis cervical vertebrae, or C2, is going to allow your head to turn on the axis. So it's going to allow it to turn left and right. So go ahead and turn your head left and right, and that's going to be based on your axis vertebrae. Okay. Now let's talk about how this happens. Because your axis vertebrae is not just turning on its own, it's really your atlas vertebrae or your C1 vertebrae that's turning back and forth on the axis vertebrae. So that's the beauty of it. And guess what's so great about this? Well, guess what? The atlas and the axis, or C1 and C2, do not have connective tissue to cushion between the vertebrae. And that's going to allow it, again, to be able to move back and forth and left and right, or twist, if you will. Now, when you look at the rest of the vertebrae, you do see the space in between each vertebrae, here, 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 and here. That's all connective tissue in between. And of course, the connective tissue as well is going to be that cartilage. Let's move on to the thoracic vertebrae. Thoracic vertebrae have 12 different bones within the vertebrae, or 12 vertebral bones, and they're going to articulate with the ribs. So we name this thoracic 1 through 12, or T1 through T12. And this is going to be our thoracic ones, T1 through T12. Now, T1 is going to be here at the top, so we're numbering always from the top, 1 all the way to 12, okay? When it comes to thoracic vertebrae, each are going to articulate with 2 ribs. And remember, articulate means to connect a joint. So you're going to see some facets on the thoracic vertebrae to allow you to see where those ribs are going to be connected here. Okay, folks, so just keep that in mind. Then we have the lumbar vertebrae, and this is going to be your lower back. There's going to be 5 of these. So again, L1 to L5. Now, some wonderful characteristics about the lumbar vertebrae, those 5 different lumbar vertebrae, is that they're very, very big. They're the thickest of the vertebrae because they have to bear so much weight. So if you think about it, the cervical vertebrae have to bear the weight of the head. The thoracic vertebrae, again, is going to bear the weight of everything above it, which again will be the head and attachments and ribs. And then you have the lumbar vertebrae, which is going to bear the weight of everything above it, which is all of this together. So because of that, you'll see structurally they are way thicker. Now let's get into the sacrum, which is going to be part of the pelvis. And it's made of 5 fused vertebrae. And so you'll see it in blue here. You can put it as S1 to 5. Okay, but they are fused, so just keep that in mind. And it's really a part of the back part of the pelvis. So here's our coxal bones or hip bones, and then here's our overall sacrum. So sacrum plus the hip bones equal our pelvis. All right, folks? Let's keep that in mind. And then we have the coccyx. So the coccyx is going to be like 3 to 4 tiny, well, I would say 3 to 5 tiny bones, but normally you really see it, and what I mean by normally is the majority of the population is going to be usually 4 fused vertebrae, and that's what you see here in this small little piece here as well. Now, they're not really numbered C1 or anything like that, so you don't really number this little piece of the bone. Okay, folks? One other thing you'll notice about the spine is that it curves. So let me erase all this so I can show the curvature of the spine. And some folks might say, well, why is it curved? Well, think about it. If your spine was straight up and down, right, then it'll be super rigid, but also be easier to kind of snap and break. Whereas when your overall spine is curved, it'll make the spine less rigid and more flexible. Okay. So there's 4 curvatures. They're going to be cervical, thoracic, lumbar, and sacral. And they act like a spring. One easy thing to think of it as well. They kind of act like a spring. So let's go ahead and label those. You have the cervical curve, okay, which of course they're named based on their actual vertebrae. And then you have your thoracic, cervical, this is thoracic. Then you're coming back and you're going to have your lumbar. And those are going to be, and then of course your sacrum, okay? So that's going to be the curvatures of the spine itself. And of course, like we said before, in between each of these vertebrae, except the atlas and axis, but all other vertebrae, you see that there are connective tissue in between it. And the goal is that it's going to cushion between vertebrae. And that makes sense because when you have to actually add weight onto your vertebrae, and then if you continue to gain weight, for example, you want to make sure that you have that cushion in between your vertebrae because they're bearing all the weight, right? These also hold folks who have like herniated discs. I mean, sometimes you could have been injured, or even if you have a certain amount of weight on you, you could basically force some of that cartilage to just spill out, which would cause a lot of pain because you might start hitting nerves. Now, again, this intervertebral disc or connective tissue is absent between C1 and C2. You can also say axis or an atlas. Okay, folks? Let's go ahead and move on into looking at the bones of the cervical, thoracic, and lumbar spine. Now, one thing that's going to make it easier is by categorizing these and making sure we focus on 3 pieces of information from each of these different types of vertebral bones. First is going to be the body. And really the overall goal when it comes to vertebrae is you try to categorize them based on the shape of the body and their spinous processes and, of course, their foramen or their hole. Okay, so body, and then we call it our foramen, again, a bone marking, which just means hole, and then our spinous process. Of course, you can have other ways that you're going in there, especially if you're thinking like, okay, what about facets? Sometimes you'll see facets as well. We'll talk about facets in relation to just one. So let's go ahead and go to cervical, then we'll go thoracic, then we'll see lumbar, okay? Now, when it comes to the body itself, the body of the cervical vertebrae are going to be very small, kind of oval and rectangle. So here's the body here, where you see the thoracic body and the lumbar body are larger. So it goes small, medium, large, right? Even though this one considered medium would just be larger than the cervical vertebrae. So first, the body is going to be, again, smaller when it comes to cervical. Next, we want to look at the foramen, the hole that's in between here. And they call it the vertebral foramen. So just keep that in mind. Now, when I'm looking at this, I see this hole is rather large, right? It's pretty large. And some folks visualize this as a small triangle. So I'm going to try my best to see how they visualize it. As sorry, not a small triangle, a large triangle. Not exactly looking like a triangle, but of course, use your imagination, right? So again, the body of the cervical vertebrae is going to be small. The foramen is going to be large, like a large triangle. The spinous process, as you see here, and there's a better view down here, the spinous process, that's going to end up being short, okay? And you also see that the spinous process is kind of split, one side and the other. Now, we're not going to focus on facets for cervical, but let's move on to thoracic. Again, the body, they call it heart-shaped, and it kind of looks like a heart shape, for example. And as you can see, the body is going to be larger than cervical, right? And the foramen is going to be small. So you see a smaller vertebral foramen here. The spinous process is going to be very long. It's going to be very slender as well. So if you see it from this view, you see the spinous process is long and slender, coming down there. You see it on this portion as well. Now, one thing you also see on our thoracic is going to be facets. Have like a facet here on both sides, and they're basically just flat. And this is where you have different types of articulations or little joints, surfaces. Now, why would these be important for thoracic? Because remember, the thoracic vertebrae are connecting to our ribs. So we want to keep that in mind as well. Now let's go ahead and go to a lumbar. So again, you see the largest body, because again, they're bearing most of the weight. And you'll also see that you have a foramen that has a similar shape to cervical foramen. Let me go ahead and make this. It has a similar shape to the cervical foramen, for example, but it is a smaller triangle. So as you can see, I drew that one that's a little bit smaller than the cervical one. So again, both have a triangular shape. Cervical is the larger triangle, lumbar is the smaller triangle, and it has a larger body. Okay, so just keep that in mind as well. As far as the spinous process, it's very short, very broad, and it kind of has this it's very horizontal. Okay, so you can think of that as well. Let's move on to just seeing a visual of the sacrum. You're going to have those fused bones, as you can see, so it kind of looks like one larger bone, and then we have the coccyx at the bottom as well. Let's go ahead and get some 3D images of this. The 3D of our different vertebrae, we have our cervical, our thoracic, and again our lumbar. Number one, you're looking at the body. The body of the cervical here is going to be smaller. Of course, we have the heart-shaped body for the thoracic, and then we have the large body for our lumbar. Next, we can see our spinous processes. Let's go ahead and get a different view of this. Let me go ahead and select a different. Okay. Now you'll see how the spinous process is kind of short, and also you see it's kind of split here for the cervical. It's way longer and slender for thoracic, and it's kind of short and broad, and like it definitely has like sort of hatchet shape for that lumbar. Okay. What else do we notice? Our vertebral foramen, or the hole, right? So as you can see, we definitely have that triangular shape here with the cervical. We also have a triangular shape for the lumbar, but the lumbar's triangular shape is way smaller. The cervical has the largest hole as well. Okay, now why does it have a large hole? Because again, that's the start of where you actually have your spine. Talking about your spinal cord. It's going to be thicker in that area, so you need the hole to be larger. Whereas again, as you get further and further down the actual spine, the spinal cord endings get a little bit smaller, so that's why the holes get smaller as well. Now, thoracic, we also see that we have a small foramen or hole, and then again, we have a small triangular for the actual lumbar. Next, we already saw our spinous processes. Let's go ahead and look at some facets that are going to be on our thoracic region. Transverse facets for where, again, the ribs can attach for our thoracic vertebrae. All right, folks, let's go ahead and look at the atlas and axis. So here's what the atlas looks like. Again, you do not have to memorize it or anything like that, but I just want to show you where that atlas looks like. And this is going to be our C1. It's going to hold the head up and allow you to rock your head back and forth. Okay. Next, let's look at the axis. This is going to allow for that twisting to the right and left, allowing the atlas to twist from the right and left using the axis here. Okay. And again, you see that there's a connections and more facets here, and more facets on the atlas. That's how they're going to help each other be able to orient properly. Let's go ahead and look at our sacrum here. Move this around. Okay. And as you can see, it's going to be fused bone. Definitely shaped interesting, right? And then we also have our coccyx here. Okay, again, fused bones, usually 4. Well, those are going to be what we have for this video, all right, folks? So again, I'll just go ahead and show you what it will look like, the rest of the pictures in your book. Go to your book and start visualizing it as well. Lab is going to be very important because they kind of go hand in hand, especially when you're just focused on structure, what is the general function of it, what's the location of it, things like that. Okay, folks? So I'll see you in the next video.